Good morning. My name is Keith Park. I'm the Director of Policy and Advocacy for the program in Global Surgery at Harvard Medical School. I'm honored to be part of the speakers today in celebration of the World Thrombectomy Day. It's an incredible program, and I'm really impressed by the efforts that this community has put forth in supporting the expansion of mechanical thrombectomy as an option for everyone around the world, especially in the developing world. Congratulations. My talk is really about the global policy landscape as it relates to places where I think mechanical thrombectomy fits. And so this is not a comprehensive review, but some useful information, I think, for this community to think about and how to apply their skills and then their efforts. I'm going to start with 2015. The reason for that is in 2015 is when the global surgery movement really started as a result of the two publications. One is the Lancet Commission on Global Surgery, and the other is the World Bank's Disease Control Priorities, third edition. The entire first volume was devoted to essential surgery. Those two documents really played a key role in having member states of the World Health Assembly, the WHO, pass a resolution in 2015 calling for strengthening of emergency and essential surgical care and anesthesia as a component of universal health coverage. That resolution really actually had a lot of leg to it, so to speak. A lot of the resolutions actually just sit and nothing really comes of it. But this particular resolution, as a result of advocacy and academic institutions, as well as champion surgeons, a lot of the countries have went on to follow some of the recommendations of the resolution. For example, development of national surgical plans. Ethiopia developed a plan even before the resolution was passed. Zambia, Tanzania, Nigeria, Madagascar, Rwanda. Countries, 34 countries in total right now have either developed or are in the process of developing national surgical plans. The regional offices of WHO, including the one in the Western Pacific, as well as the one for the Americas, have both member-driven, passed regional action plans to strengthen surgical care as a region, as both of these regions. This is really amazing progress. So this map shows the countries in blue that are either developed or are in the process of developing national surgical plans. And this is becoming bluer and bluer every day. So why do I start with global surgery? Because within the global surgery movement, there are neurosurgeons, including myself, who are demanding that neurosurgical conditions are prioritized when countries expand surgical systems. Global neurosurgery is here to stay. And most recently we had a meeting in Boston alongside the American Association of Neurological Surgeons annual meeting. There was a 2-day symposium. The second day was dedicated. This was the MGB, Mass General Brigham Global Neurosurgery Symposium, dedicated to global neurosurgery. And we actually had pledges by organizations. There were 92 pledges in total, I believe, setting us in motion for the next decade of global neurosurgery with alignment and collaboration. We're in a very good position for that. And one of the key conditions that the global neurosurgery movement and community is prioritizing is the stroke, which is, this is why I think it's so important for me to tell you about it, because this is time for us to work together. But not only is stroke important to neurosurgeons, but also to neurologists. And one of the most exciting things that happened in the global policy landscape is the development of the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. We call it IGAP. This was passed by the member states of the WHO. And this is the first time ever that WHO, the member states, have developed an action plan for neurological conditions. This is the decade of the brain, neurological conditions, whatever you want to call it. And there are so many things. This is a very broad and comprehensive approach to improving the management of neurological conditions. Things like policy prioritization, development of policies within the country to prioritize neurological conditions, Treatment goals, 75% coverage of certain types of treatment for all countries. These are aspirational, of course. Promotion and prevention, things like folic acid for prevention of neural tube defects. And then research into these conditions. They're hoping to double the amount of research on neurological conditions by year 2030. So this is the kind of global governance actions that are happening right now, which puts us in a very good position. When I say us, people who are trying to improve access to procedures like mechanical thrombectomy. And I just want to spend a little bit of time on what's happening in Indonesia. Indonesia, under the new health minister, Budi, who is the picture on the upper right, Minister Budi has managed to push through a $4 billion package, a financing package to invest into the Indonesia's health system. This is the largest ever a package of health assistance from any of the development banks. This is unprecedented. How is he going to spend that money? Well, part of that money is going to go into reducing stroke deaths. And he's trying to do that by having in every district facilities capable of providing mechanical thrombectomy. You heard that right. So in order to do that, he will now have to equip, I think, over 400 facilities with cath labs. There's already, I think, 83 facilities with cath labs. He wants to have an additional 400 cath labs built out. And Philips has been chosen to build out all those cath labs. And I was in a meeting with Minister Budi and Philips and a number of other people in Washington, D.C. around the World Bank spring meeting. And the idea that they need help with training came out. So they said, how do we train people to staff over the 400 new cath labs? And Walter Johnson was in the room with me, and he was on the Lancet Commission on Stroke. He was at WHO as the lead for the surgery program. And he and I looked at each other saying, you know what, we can take this message and we're going to come back to you with some answers. So just Friday, which was 2 days ago, we met with the Indonesia team in charge of scaling up stroke care. This is the National Hospital for Brain and Neurological Conditions. And they shared with us their strategy in expanding mechanical thrombectomy services through the entire country. So here's a huge opportunity for us. We're working with Ali Aziz Sultan, who's the director of the Cerebrovascular Lab. Some of you already know him, Walter Johnson. My hope is that after this, the webinar, some of us will get together and have a Zoom call and figure out how we can best support Indonesia's efforts. I think there will be actually funding available to help with the training process. It won't be a volunteer effort. I think it will be covered in some way. So anyway, that's end of my talk. I'm eager to hear all the other talks as well, because I'm learning so much from you all. And I look forward to hearing back from some of you about how best to collaborate and support countries like Indonesia with mechanical thrombectomy. This is my email, key_park@mail.harvard.edu. I look forward to hearing from you. Thank you very much.